a few minutes.
Trummel, and I'm the Trauma Outreach and Injury Prevention Program Coordinator.
I'm Dina Bailey. I'm the Pediatric Trauma Coordinator.
And we are here to talk to you guys today about an in-hospital child abuse prevention program that we run called Shaken Baby Syndrome Discharge Education. This is a program designed for admitted families. So the only people that get this particular program are those patients and families that are admitted to UMC. But it is a three-part program. The first part is a video. It's an 8.5-minute video that discusses it's called The Dangers of Shaken Baby, but it discusses Shaken Baby and what that looks like. And it also has what to do if you're crying, how to pick your caregiver wisely. It just gives all different types of tips and tricks and to help parents in that first, in those first, few months of life. And then the second part is a pamphlet and education from the nurse. And the third part of the program is actually a social contract. Now, this is not a legally binding document. It is something that goes into their medical record that shows that they completed the program and that they signed it. And that social contract, what it says in there is, I won't shake my baby. Here's a number that I'll call if I get frustrated or upset. This is a soothing technique I can use. And then we encourage the nurses to educate both family members or both guardians, whoever is able to be there at the time. COVID kind of threw that for a loop because we couldn't have two parents at the bedside all the time. But then they sign, both parties sign, and then the nurse also signs. And then they take a copy of that social contract home and they take the pamphlet home with them so that they always have those resources. And our hope is that in that massive discharge paperwork that you get when you leave a hospital, that if they pick certain things to keep, we hope that it will be the social contract that they can put up on their fridge, as well as the pamphlet, seeing as that has tips and tricks, as well as lists of resources, of community resources that our families can access to help in case they need it, for whatever reason that they might need it. We've educated over 8,000 families with this program since April of 2018. We had started a study in partnership with UNLV and their Nevada Child Abuse Prevention. Sorry, I'm not saying that correctly. I apologize. But we started a study and then COVID hit, and unfortunately we have had to pull back on that because we couldn't have people on the units and in and out of hospital rooms and things like that. So our goal is to quantify and qualify family participation in this program, to kind of see where we can improve, what people are taking away, what knowledge retention they have from this program, maybe at 3 months and then again at 6 months, to see if they're talking to family members about what they learned, things like that. So that's kind of been our goal with this program. The only thing right now is that we have seen less patients that were seen at UMC return then as abuse cases. So prior to April of 2018, we weren't providing any education regarding this to our new parents or to parents with kids under the age of 3 that were admitted to the hospital. And since then, we have had less kids that we've seen for whatever reason or that were born here then return as abuse cases. So that's kind of how we're looking at this. Dina and I both track all abuse cases that are admitted, and those abuse cases include Shaken Baby, they include intentional burns, they include neglect. So those kids that are admitted to UMC for any of those causes, we track those, as well as kind of comparing what that looks like with our numbers from before and our current education program. That's kind of all we have. Dina, do you have anything to add?
No, that's that's a good
synopsis.
Good synopsis of it. That's pretty much it in a nutshell.
Are there any questions we can answer?
Perfect. Thank you guys so much for sharing about your program and providing that overview and introduction. We are happy to have you here today to talk about this important topic. So our next panelist that we want to introduce is Debbie Harpster. And she is here representing Prevent Child Abuse Nevada, but she also does other work in the community that's related. So Debbie, if you want to say hi and introduce yourself and talk a little bit about your work.
Thank you, Amanda. Yes, my name is Debbie Harpster, and I am representing Prevent Child Abuse Nevada, which is a program out of the Nevada Institute for Children's Research. So I work very closely with Amanda, as well as Myra Pacheco, who's also on the call, and she'll also give you a little bit more information. I volunteer as the chairperson for the advisory board, and I have been working with Prevent Child Abuse Nevada ever since their inception out at UNLV since 2011. So going on 10 years now. And as a volunteer with Prevent Child Abuse Nevada, I appreciate the opportunity to keep my role as an advocate, not only in my professional life, but in my personal life as well. And so with the advisory board, and of course, we have representatives that are statewide because Prevent Child Abuse Nevada represents the entire state. We serve as the Nevada chapter for Prevent Child Abuse America, which is our national organization. So our mission is to ensure that Nevada's children thrive in safe, stable, and nurturing environments and relationships. And we do this through providing education, advocacy, and awareness. Prevent Child Abuse Nevada aims to inspire everyone to prevent all forms of child maltreatment. And as I was about to say, our advisory board has put together a list of policy priorities that I'd like to share with everyone in the state, those who work with children, parents, and of course with our state legislators as well. We determined that we have 3 priorities for assisting children to meet our mission. The first of those is preventing child sexual abuse. And of course, we want to support statewide collaboration on prevention of child sexual abuse. And we're doing that through improving public policy, the programs and practices that will protect our children in the future. Our second policy priority is preventing childhood trauma, or ACEs, which are adverse childhood experiences. And Myra's going to talk a little bit more about the types of actions that would entail. But basically, that's promoting implementation of evidence-based trauma-informed policy and practices, bringing awareness about ACEs as well as toxic stress. And our last priority is to promote resilience. And you probably all know, but resilience is the process of healthy adaptation by individuals when faced with those adverse circumstances. We want to promote protective factors, identify interventions to support resilient children, as well as their families and our entire communities. And right now, that has been one of the main focuses of the programming that Prevent Child Abuse Nevada is doing through providing online education. And Myra has been doing a bang-up job in conducting a number of online trainings to people throughout the state. One thing that I also want to mention here is that in my professional experience, I actually serve as a training specialist with the Rape Crisis Center here in Las Vegas. We have a program that is actually only a year old. It's called RISE, and it is the program that supports victims of human trafficking, both sex and labor trafficking. And if you've heard anything about it, you know that children, unfortunately, have been victimized and are victims of child sexual exploitation. So we assist children with any types of situations that they might need assistance with. and we help surround them with case management. We help get them any housing they may need or any other services to help them come to a better place after being victimized. As part of the research that I had to do to provide education on prevention and response to human trafficking, one of the things that really hit me was the risk factor that child sexual abuse provides as becoming a victim of human trafficking. Most of the research out there points to the fact that of those victims that come forward, 70, as much as 90% of them experienced child sexual abuse, either just recently if they are a child, or in their past if they're an adult victim of human trafficking. So I really would want to urge everyone to take advantage of the programs that are available right now, and also help legislators and encourage them to provide additional funding so that we can provide evidence-based and culturally competent education to prevent child sexual abuse. And together with the Rape Crisis Center, Prevent Child Abuse Nevada provides that education through the Enough Abuse program. And that is child sexual abuse education for those that work with children, parents, as well as the general community. So that is actually available right now. Prevent Child Abuse Nevada is actually conducting that training on a regular schedule online as well. So I encourage everyone to look into that. Also, together with the Rape Crisis Center, we Prevent Child Abuse Nevada supports implementation of additional education for children to help protect themselves. And we have a number of programs at the Rape Crisis Center that can do that as well. Of course, we haven't been able to provide that because of COVID, but once school comes back in session again, we hope to bring that back up and help educate children. But of course, the onus has to be on the adults, right? Our community members. So we definitely encourage more education, and we encourage everyone out here to take advantage of the opportunities that are available to learn more about prevention and responding to child sexual abuse.
Thank you so much, Debbie, for that great overview. And we're going to have Myra, if you just want to introduce yourself as well.
Hi, good morning, everyone. My name is Mayra Pacheco, and I am the program coordinator for Prevent Child Abuse Nevada. I provide most of the trainings for Prevent Child Abuse. And, some of the things that I just wanted to mention, Debbie, I think you covered it all. You're fantastic, and we're so grateful to have you in our board. But yes, the trainings that we are providing right now are the Enough Abuse. We are focusing on that one with a partnership with the Rape Crisis Center, as well as the PPP, the Positive Parenting program that I'm able to provide the seminars thanks to the Parenting Project. And we do have, monthly public trainings that people can sign up for. So you are welcome to sign up to our newsletter and get those announcements. I love to promote programs in the community. So when I give PPP, of course, I refer to the Parenting Project, to Boys Town. I love to provide resources to the parents that listen to our trainings. Many of them, this is the first time they're listening to parenting classes, and these are very easy to digest seminars that can then lead to more in-depth training for parents. So I do love to reach out for resources. So if you do want to share that with me, I do add additional resources to anyone that attends our trainings. And you can go to our website to look at the set of trainings that we provide. And we are happy to provide training for our staff, as well as for parents and community members. And we do have a toxic stress and high-risk behaviors training going on right now too. And the last thing I want to talk about is Child Abuse Prevention Month. So if you don't know, April is Child Abuse Prevention Month, and we encourage you all to really focus on the happy and healthy childhoods that our children deserve. So with Prevent Child Abuse Nevada, we do have our Pinwheels for Prevention campaign. We encourage anyone to join us. And we do have a toolkit that is available. I just sent you the link. You can look through the toolkit. We have flyers, we have activities, we have different things that depending on your program, you can implement. If you want to do something special, you know, schools have reached out to us, programs have reached out to us with ideas that they might have, and we are happy to work with that. Or if you want to promote a training in your site, we can do that as well, you know, or a virtual training, of course, you know, we can do that. So we encourage you to be part of Child Abuse Prevention Month. We have virtual backgrounds. So I know that we are all having like 1,000 Zoom meetings a day. So you can have, you know, for Go Blue Day or for the entire month, you can have our background and just, we have the pinwheels as a reminder of the happy childhoods that every child deserves. So if you want to promote, you know, the pinwheels and wear blue, and more than that, just really focus on collaboration. We are all doing great work, and we really care for our community. And I think collaboration really helps us strengthen those efforts. And that is a big part of Pinwheels for Prevention, for all of us to work together and really support our children and our families. Yeah, that's what we're about. And we're so happy to have you join us today. Thank you.
Perfect. Thank you so much, Myra. And we still have pinwheels left. We're shipping them out right now. They just got into our office. So if you want pinwheels and haven't ordered them yet, please let us know. So I'm going to turn it over to our next panelist, who is John from Boys Town. If you want to introduce yourself in the organization and why you are here today.
Thanks, Amanda. Appreciate it. Myra, we love the work that you guys do, and thanks for the continued support for us as well. John Etzel, Executive Director of Boys Town, Nevada. I've been in the Valley here for 30 years, and our work is focused on that early intervention and prevention work being done. We do a lot of direct services in the homes of families. Through our in-home family services and our care coordination, which is more of that case management and really that referral side of things, but with the goal of increasing protective factors within the family. We want to work with the parents, develop their strengths, create a game plan around areas that they need to continue to improve, knowing that the fourth grader that that we may have gotten their referral around, there's probably a second grader and an eighth grader and a few other kids in that house as well. So if we're focusing our efforts on the parents and not just that one particular child who may be having a challenge, then we know that that the parents and the family in general is going to have a much higher chance for success. We want to see that self-sufficiency with all the families that we work with increase and improve as well, so that they are able to continue to develop their skills within the community also. As Myra mentioned, we've got a Parenting for Success classes that we offer, currently doing everything virtual, and those can be 6 to 7 weeks long, an hour or so a week, and we're now doing them all over the state. We're thrilled to be, not just in Clark County for those classes, but reaching more of the rurals as well. So we're excited to see that part continue to expand. We've got a behavioral health clinic here in the Valley with 3 full-time child psychologists, all doing evidence-based practices, working with kids as young as 2 years old and all the way up to 19 or 20 years old as well. And again, it goes back to those protective factors and ensuring that kids are able to make decisions that are keeping them safe, but working with parents and those caregivers as well, and whether that's partnerships with other organizations such as CASA and some of the adoption folks around town as well, but working with foster parents also. We appreciate that opportunity to continue to expand as well.
Perfect. Thank you so much for that description. And that leads right into our next group as well. I believe we have Jenna who's going to talk about CASA in Washoe County.
Yes, thank you. My name's Jenna DeWar. I am a lifelong Nevadan, and professionally, I work for the College of Education and Human Development at the University of Nevada, Reno. I'm an internship coordinator there, and so I know some of your organizations from working with you through that capacity. But I'm here today to talk to you a little bit about my philanthropic role. I am the past board chair of the Washoe CASA Foundation, and I have been a court-appointed special advocate for just about 10 years now. My 10-year anniversary is coming up in October. And I know you've heard a bit about CASA today already from kind of a global scale in terms of what our program does. But for those of you who may have joined a little bit later, CASA serves our local youth as a guardian ad litem when they are placed into the foster care system as a result of child abuse or neglect. And so personally, I have served children all the way from birth through age 18. I actually had a child in utero once that was assigned to my caseload because I was assigned originally to their older sibling. And I also have had children all the way through their 18th birthday, and I'm still working informally with one of my youth who just aged out last month. And so one of the main roles that we as CASAs play is that we provide continuity for the children through this experience of being in foster care. For example, I had a child from 20 months of age through the day before her 5th birthday when she was adopted. She had been in 3 different home placements with her parents when we tried to reunify, apartment, a homeless shelter, another local complex in town. She had 3 different foster care placements, her adoptive placement, 6 different teachers throughout that time, 4 different social workers, and through the duration of her 3.5-year case, I was the only person who was there from start to finish. And so that's often the story of a CASA, that we're the person who provides that continuity and providing an active voice for their best interests, both in the courtroom and in the community. One of the, kind of most important roles that we have is that we as CASA volunteers are often ensuring equitable access for our youth to different services and education. So some examples that I can provide for you as a CASA, I have sat in on parent-teacher conferences with my youth before when maybe the foster parent didn't feel as though they had known the child as long and that I could serve as a better voice for their interests. Currently with COVID, I, supported my youth in getting access to technology so they could continue to attend school in kind of our remote and digital age. I've provided rides to tutoring. One of my favorite examples of kind of the work of a CASA is that one time my husband and I actually were both serving as a CASA team together, and we had a youth whose therapist had recommended that they get engaged in activity out in the community, some sort of sports, in order to help assist with ADHD and a medication regimen we are working on. And as CASAs, we were able to facilitate getting our youth to those soccer lessons that we signed him up for. And also through the support of the Washoe CASA Foundation, we paid for those lessons for the child. Often the work that we do, we are funded by the Washoe CASA Foundation and just helping to provide that equitable access. I think one of the most important ask that I can make of this group as we talk about upcoming legislation and upcoming, opportunities to support our youth, one of the, most important asks that we can make is that we continue to encourage for legislation to support programs like CASA and many of the other programs that are here today. And I think, in the call right before this that we were talking about Coffee with CASA, in Washoe County, we have about monthly events where we come together with a couple of current volunteers and a number of prospective volunteers to talk about the work that we do and to help clarify the role. And I think if those of you on the call are interested in becoming a CASA, connect with your local CASA chapter for some sort of an information session. Consider attending a Coffee with CASA, even if you as someone who does this work on the daily basis, if you feel you can't be a volunteer yourself, you likely know the right people who could fill this role. And so bringing them to a Coffee with CASA, or thinking about hosting a Coffee with CASA for your organization, even just allowing those that you work with to have a better understanding of the work that we do allows for the mission of CASA to be extended. So I know that Erica is kind of acting as my Vanna White and behind the scenes. She just added the link to our Coffee with CASAs. I think it would be wonderful to just continue the conversation of supporting those of us doing the work and find the right volunteers. But I'm happy as this panel continues to answer any questions about the true behind the scenes of the day-to-day life of a CASA volunteer, because I feel as though as a volunteer position, it's a great extension of a lot of the work that all of you are already doing professionally, and a great partnership where ACASA has often interacted with all of the components that you are all working on. So thank you for the work that you do. Thank you for having me here today to talk a little bit about what I find to be my philanthropic passion. And yes, I'll hand it on to the next panelist.
Thank you so much. That was a great, great insight to the organization and how to get involved in what's needed to move forward. So we have one more panelist that I'm not sure, I don't see them on, but do we have a representative from Eagle Quest that's on? Okay, they may not have been able to join us this morning. So, so that's our panel for today. And we want to thank everyone for giving again an overview of the organization and the work that we're doing. And so we're going to open it up too to see if anybody has any questions for the panelists. And as I give everyone a few minutes to kind of percolate what they might want to ask our group. I want to start off with a question to say, what do we think is needed most in our community in order to really prevent child maltreatment from occurring in the first place? What is something that our community needs to do in order to make that happen?
I'd love to speak to that. I think that both my professional world and my personal world, revolve around this topic so much. And I think that one of the most supportive things that we can do is to continue these conversations and continue them proactively and with a loud voice, right? There are a lot of families who could utilize the support of our programs, could utilize conversations that destigmatize the experiences that they're having and allow them to seek the support that we can provide. So I think that the continued conversations in all aspects of our functioning is so pivotal with the topic at hand.
Thank you.
I really think that there's a lot of work that can be done on the education side of things as we look at it from a prevention perspective, knowing that the power of education and getting information into the hands of even high schoolers. The parenting program that we offer, I'd love to see that even filtered down even more, because oftentimes what we're doing is it's just so reactive. And everything we're doing then is based to stop it from happening again. How do we get to the point that the work that we're doing and the education that's being provided is at the level where it's stopping it from happening to begin with? I've been chatting back and forth with Cassie a little bit, about the work that they're doing and how our parenting classes strive to prevent that shaken baby, or prevent some of those issues that then land somebody in the hospital. I believe strongly that we need to focus more on the education and earlier for young kids, for young families, for folks that are pregnant, so they know what the skills are that they need to have when their baby is 3 months old and unsure what to do at that point, and they're crying all the time. Been there, done that. 3 kids of my own. It's a challenge, but with that level of education can really, I think, put forth more opportunities to stop it earlier.
Thank you, John. Does anyone else want to contribute for that?
Yeah, I would like to contribute. To me, I think I really love that we focus and we talk about the interpersonal level. I believe in that healthy relationships should start even before high school, right? We should start talking about consent and healthy boundaries and communication skills, social skills, starting pre-K. I've been in schools and you can start as early as pre-K talking about boundaries, right? And talking about consent and health in healthy relationships. So I do love that. What I do want to bring up too is looking also at systemic injustice and looking into being anti-racist, looking at cultural competency, and really looking at our policies, looking at systems in place, and seeing if there are any harmful policies that we can really reevaluate. If there are anything that is, there are requirements in our agencies that, maybe we can remove that are not needed, and really looking at our approaches, looking at unconscious biases. If we really want to prevent child maltreatment and promote safety, it also goes looking at affordable housing. Right? It also goes into expanding our frame. So I do encourage that. I do love that we look into the interpersonal and individual level, but we also, I also want to always remind to expand ourselves and look at how the systems play a big role in the experiences that families and individuals have even before they are born.
Absolutely. And again, we participate too. If anybody from the audience would like to, or the audience, if any other participants on the call would like to chime in too.
I would.
Sure, Bridget.
As a mother of 8, a mom to many, as well as a foster mom as well, I see the whole totality of things. And is it Myra? I couldn't agree with you and Jenna anymore. Okay, the only thing I would include in that is comprehension. Okay, because people can, we can communicate all day, but do you comprehend what's being communicated? Do you comprehend the dialogue being discussed? I have this saying. Now, of course, it's an old African proverb. It takes a whole village to raise a child, but village to me is victorious individuals lending love abundantly to generations evolving. That's you, that's me, that's us as a whole. Okay, it takes the entire community, and we can't be one way here on a panel and then totally different off screen. Okay, we can't sit here on a panel and suggest that, we be personable and that approachable. And all those politically correct answers sound so beautiful. However, when you have that child who's actually going through, when you have those teens actually going through and trying to comprehend, trying to understand what's happening with them as they transition from young adult to adult life, as they try to understand that, you know what, toilet paper ain't free. Okay, as they try to understand life in a whole, as well as dealing with what they grew up in, the system, okay, what they grew up in, many of them living out of their suitcases, being moved from one place to another, okay, not knowing really what stability is. Okay, so we could sit here and we could talk to a child about stability, but if I've been moving my entire life, I have no clue what that means, okay, or that doesn't apply to me. So I just think that I always believe in trimming the fat off the top, okay, and here we are, village, we're here. And we have to now go out there, or we're going to have young people approaching us. And when they approach us, or when we come across them, I'm an advocate for our youth, so I speak for them, and I'll say the things for them that, people may not necessarily understand if a young person come talking street language or whatever, okay? And that's just a gift and a curse for me, being able to communicate from the street level to the corporate level and all in between. When you have someone, a young person coming to you with an issue, we cannot sit on the panel and be one way, but then when we're out there in front of them, because you don't understand them, you now want to treat them a certain way. Okay, well, yeah, we'll deal with that tomorrow. No, the problem is now. The child has the question now. If you don't know the answer, then say that, okay? But don't just brush that child off. Talk to that child, because that child is a little person that's gonna grow up to be a big person who will grow up to have some mental challenges, mental illness, and we wanna work towards mental wellness. Okay, so I just think that because we live in a monkey see, monkey do world, when we talk, panel, we can't just be one way here on screen and I'm going to be this way because, you know, Jenna's here. So, you know, I really have to say the politically correct answer. No. However you are on screen, be that way off screen, be transparent. Okay, because the only way children take to us as adults who have been there and done that is when they feel comfortable with us, when they feel like we can relate, or they can relate to us, or, you know, this person has always been honest to me, whether the answer was good, bad, or ugly. Okay, and I just feel that if we do our part as a community, as a person, as if we do our part, then it'll make everything else, it'll have a ripple effect and it'll be just that much easier. Okay, so we must keep in mind that we are the village. All right, we are the village, and because the village is broken and shattered into pieces, well, we're the ones here right now that's trying to bring it back together. We're trying to put the pieces back together, but we can't put pieces back together if you don't feel comfortable talking to this child about being a gang member. And by the way, I used to be that too. So you don't feel comfortable talking to that child about that, about his or her pants hanging off her behind. Well, then you know what, that's fine that you don't feel comfortable. Plant the seed. Just because you plant the seed doesn't mean you're the one there to water the seed. That may be somebody else's job. That might be Myra's job. Okay, that might be Lynn's job. That might be John's job to transplant. Okay, but we all come together as a community and do our part for the benefit of these young people, or we're going to continue to have a bunch of people who are misunderstood, who are confused, who are scared, who don't know how to channel their energy or their emotions, okay, because we talk a good game on screen, but we do something different off screen. I'm just saying, if you're going to be transparent on screen, be that same way, keep that same energy when you're away, keep that same energy when you're in your apartment, when you're in your house, when you're on your block, when you're in the store, and things like that. If we start doing that, then we're good, okay? No one knows that I'm a life coach. You don't know that I used to be a project manager. No one knows if this person is executive this and executive that. Kids don't care about that. I don't care you're executive this. Can I trust you? I don't care what your title is. Okay, are you someone I can talk to? That's what I want. I want someone I can talk to, someone who understands me, and someone who will not judge me at all. Because there are plenty of adults, and I'll close it up here. There are plenty of adults who play the role like they've never done any wrong in their lives. So why would a child come talk to you? You don't understand me. So when I talk to children, I let them know that, you know what, I'm 51, not 15. However, I have been 15, okay? And at your age, I sold dope, okay? I was gangbanging, I was this, that, and or the other, okay? But it still didn't stop me, even though I dropped out of high school, it still didn't stop me from getting my high school diploma, my GED, my associate's degree. It didn't stop me from moving forward in life. Okay, that's just my history. And I guess I had to go through that because I was going to eventually come across you, and I was going to have to be that inspiration for you. So if I did it, you can definitely do it. So again, the same energy we have here, if we keep it out, if we keep it off screen as well, then we can bring the community together, and we can have children who trust us, and we can have productive citizens in our society growing up, going forward. That's just from the book of Bridget. Ain't no book out there for real, but I'm just saying. Thank you.
Thank you so much, Bridget. I think everyone is very inspired by your words today, and we're so thankful that you're joining us and part of this conversation. So does anybody else have any questions for our panel, or any thoughts on this topic that they would like to share? I see lots of great people. If you don't want to talk, you can also put it in the chat.
I have one little piece that, pulling out of what Bridget said, I think is so important, is her comment on the fact that we all need to do this work. We all need to do our part. And I think that the notion that if the community were to each take a piece of this authentically, genuinely, and with the passion that we're all sharing today, it would be, you know, the start of that progress that we're all here today hoping for. And so I think that for me, one thing that I'm taking from this is that reminder that my reach extends in my space, and I need to be active in that and productive in that more than I would just by being present, but intentionally and repetitively. And I think that that is an incredible part of this conversation, that we all are here together. We all have a next sphere of influence, and hopefully that sphere of influence can continue as well. So I applaud everyone for being here today to get started on the next part of your journey, and wish us all the best in continuing.
Excuse me. I would kind of echo a lot of what Bridget has stated. I think it really is, and in that village approach, it really comes down to, and it also goes back to what John said, preventative services and how we address and work with the families beforehand, and developing that trust with them. The community does not trust the system, and they wouldn't trust the panel. Why would they? And so I think it really is developing that trust, but it goes back to exactly what Bridget was saying. You cannot be one way and then be the other. And I think the system itself is designed to say, I'm trying to help you with this hand, while on the other hand, I'm doing everything to prevent you from getting that help. And so I think as we look forward to looking at how we can prevent child abuse, or how we can even begin to address that, it really is this comprehensive approach of where we have to look at how we can look at it beforehand and work with the parents, developing that trust and that education. I don't want you in my home, and I don't want you. I don't want your help if I can't trust you, despite what you say. And so then also looking at it from the youth's perspective of, I want the help. I'm going to do everything to show you that I don't need the help, but I do want it, and I want to see how long you'll stay in it. How long you'll stay in it for. So I think it really is understanding and really looking at the preventative services. It's so important to get the youth beforehand. I hope with the rollout of the Family First Act that we'll see a lot more services go towards youth entering the system, or services going towards preventative, where it not only addresses child placement, but also addresses food insecurities and workforce and housing and all these other things that lead to youth being in these situations. Lack of education is one thing, but lack of resources is a total different. And so needing to address and access those services, and not placing those limits, and understanding that Nevada ranks amongst the lowest when it comes to being able to receive funding and receive services. And so how can we as a community come together to, one, voice that, and two, what can we do collectively to bring folks at the table to develop and provide this village approach, this one-stop shop kind of system, instead of the families and the youth being bounced around.
Thank you, Deshaun. That was a great summary, and very much needed in our community. And I think your final ask is something that I want to make sure that we close with. So I would like everybody who's on the panel and others who can say that, you know, for our policymakers that are looking to figure out what is the best move that we can make for our state, what is the one thing that you would want to leave them with as they go through this session? What would your ask be to them?
I'll go
Hi,
ahead.
Debbie.
So to piggyback on what Bridget and Deshawn was saying, it sounds like the thing that we really need legislators to understand is that we need programs that meet families where they are, not forcing them to fit into these silos or this special program eligibility. It really is important that we take programs out to the communities where the help is needed. So I would definitely ask legislators to look for funding to support culturally competent programs that will address the different socioeconomic types of conditions that we are living with, not only here in Las Vegas in the urban areas, but in the rural areas as well, since we are so diverse in the types of geographic space that we are dealing with here in our state. So definitely providing those basic needs, that is child abuse prevention, because then parents won't get stressed and then take it out on their children.
I can go next. To me, something that just really like, I feel it in my heart right now is don't make assumptions on what the needs of the communities are. That to me is vital, and I want to make sure that legislators keep that in mind. Many of us that are in the places of decision, we don't know all the communities, we don't understand the communities and their experiences. And I think we need to come out of making assumptions of what those needs are and really look into seeking to understand. We may not fully understand the experiences that communities are having, but we can seek to understand and really look into the input that these communities have and what their needs are, how can we support them? And more than that is also looking in the power and the value in each of these communities and look in the strengths, and not just look at, what is lacking, but look at what is there and the power and the value in these communities and really look into growing and cultivating that.
This is Deshawn again. I think one of the things that I would leave you all with, and that I think is also so important, is including them at the table. The reality is many of the organizations here and many of the organizations that provide these services do not have youth, and they don't have the families that are actually going through these situations at the table, or they include them at the very last bit in this kind of tokenized system. And so I think it really is bringing them in the beginning and having their voice just as valuable as someone that has a degree and that has worked in that field. So I think it's so important that you include them at the table. Something that we have been strongly doing here at CAA is ensuring that we have the voices of the youth and that we have the voices of the adults and that we have the voices of those that are actually going through and that need the services. Because you cannot provide adequate service if you do not know exactly what's going on. Textbook does not provide you with all of the information. It comes from experience. I think that's one of the beautiful things that Bridget brings, is she brings that personal experience. You cannot learn that in a classroom. There's a lot of things you can, but you cannot learn exactly the needs. On top of the fact that the needs change, they don't necessarily, in one area they change, but in many cases they stay the same. And so really working and having those folks at the table and having them at the table early and including their voice and showing that their voice is valuable. That sometimes means changing the time of the meetings so that you can have a young person attend those meetings, so that you can have a family that works crazy hours being able to join and have their input. So I definitely would say include from the beginning and have their voices heard.
Thank you so much, Deshawn. And that is why Deshawn's panel is in the afternoon at 3:30, which will talk to the youth experiences. So that way we were able to hopefully have youth that can participate after school time. Perfect. Does anyone else want to have any final comments to leave our policymakers with?
Hi, my name is Jessica. I just wanted to kind of elaborate on what Deshawn was just saying about having the children at the table. And I also feel like there needs to be a little bit more accountability in the advocacy for these children. I've witnessed a lot of kids reaching out for whether it's tutoring help or being heard in court or just different things, and there's no follow through, whether it's from caseworkers or a judge's standpoint or the schools. I think that there needs to be a little bit more integrity, especially when these kids are actually reaching out. And again, how are you going to trust a system that we know is inherently struggling, and then they have a voice and stand up for their needs, which is something I really work on teaching the kids, is standing up for your needs and advocating for yourself and vocalizing, and then they get nothing in return. So I just think integrity and advocacy for these kids. So I love what Deshawn said about getting them at the table and having them be a part of the conversation.
Perfect. Well, I want to thank everybody. Oh, Bridget, did you want to say? Go ahead.
It was just piggybacking pretty much off of what Deshawn said, as well as Jessica. You know, Deshawn had mentioned people with degrees and things like that. And I've always been big on hands-on experience can trump any degree, any given day. Okay, because all you can tell me is what you know out of a book, and I can tell you what I've actually experienced, okay, and what's actually happening out there. Now, that's not to negate or undermine or downplay anyone's success at receiving a degree, okay? That's not to do that, but it is saying that hands-on definitely is, it's a plus, as well as the mentioning of the people at the top, the legislators, and I just have an issue with that, because if this is such an important ordeal, then arrange your schedule so that you can be at this meeting, okay? Fix your schedule. Just because it doesn't apply to your child doesn't mean that it's not happening to a child next door to you, or maybe your niece, your nephew, or whatever. Just because it's not happening to your family member doesn't mean that it's not important. It is important, and it's important enough to now the legislators want to discuss it. Okay, well then make time to come and be a part of the panel. You would want to do that right now, huh? Anyway, I've always said that as far as politicians and things like that are concerned, I really think that people should be required to live in certain communities. They should be required to have to live like the people in their communities, even if it's just for a week, okay? Just to get the full effect, the full feel of how these people live and what they deal with. You should be required to see what beans and rice taste like outside of filet mignon. Okay, you should be required to see what it's like to have your only choice is top ramen. Okay, you should see what it's like to sleep on the floor rather than going to a hotel with all the perks and all this other cool stuff. I just think that, you know, because they won't come from the top, in order to know what's going on out there, what's wrong with us? I mean, I just relocated here from Oregon, but I used to do a battle of the sexes here every year, okay, at Sunset Park to bring the communities out, all right? Just to show face that somebody's here. And yes, Jessica, I am huge on follow through. Okay, so you talk to me today, what's happening tomorrow? And then what's happening the day after that? Okay, and then what we gonna do after that? Come to me with a full plan, okay? And I'm saying that from the mindset of a 16-year-old, because that's when I dropped out of school, okay? And I didn't want to go to school because I was making more money slanging dope than I was in the school, but I knew that that life was only gonna lead me to jail, heaven, or hell, okay? So give me something else to do. Give me something to look forward to. Don't come and give me a bunch of beautiful words and then you leave me and you go eat at the finest of the finest restaurant and I'm sitting up here going to steal me a Snickers out the 7-Eleven. Okay, so follow through is big. It is huge because kids want to know that, you know what, you said this to me. Okay, so what is this something I can do tomorrow? And even if you just have them filing some papers, something, okay, that might seem so minute, so minor, so to you may be the biggest thing to a child, because they just want to know that they have that support. They just want to know that somebody is there, somebody cares. And you know, and we've all heard, we've seen young people come back and give testimonies on that one person who believed in them. Well, just imagine how much more if they had 10 people who believed in them, who followed through. Okay, so I just think the follow through, what Jessica said, is A100. And I'm done for real this time.
Well, thank you all so very much for providing your insights and your comments and sharing about some of the resources that we currently have in the community and where our community still needs to grow, and the supports that we need to continue to expand to make sure that our youth and our family have what they need in order to really be able to live up to their full potential. So just a reminder that we are recording these sessions, and we sent this out into the email to some of the panelists, but I want everyone to know, since we have other people participating, that